The number one question I get on social media is this: how can I get bigger? How can I get longer? Or how can I get more girth? Today, I'm going to answer those questions. I'm Dr. Sarah, a urologist with over 20 years of experience helping men navigate these exact concerns, and I will share what the science truly says about penis length, girth, and enlargement treatments. There is so much misinformation online, dangerous promises, and unproven procedures that can cause devastating and permanent harm. My job is to separate the hype from the truth. Subscribe now, because this information is based on clinical evidence, not marketing claims, and it's knowledge that every man deserves to have before making a decision that could impact his health for life. In the next few minutes, I will walk you through what works, what doesn't, and the one crucial first step that studies show is more powerful than any device or surgery for most men. The truth may surprise you. Looking at this flood of questions in my inbox every single day, I realize we need to have an honest conversation about what's really driving these concerns. Because in my 20 years of practice, I've learned that this isn't actually about anatomy, it's about something much deeper. Let me share Robert's story. He's 68, a retired electrician who's been married to Helen for 42 years. Robert came to me already working well with his family doctor to manage his blood pressure and diabetes. What he wanted was relief from a growing anxiety that was affecting his confidence and his marriage. I coordinated with his medical team, and together we focused on addressing both his psychological concerns and his overall cardiovascular health. Within 3 months, Robert noticed he felt more at ease with himself and more energetic overall. His doctor was pleased with his improved circulation markers. Today, Robert continues both his medical care and our comprehensive approach, feeling more confident and connected than he had in years. Here's what I've discovered through working with hundreds of patients like Robert. The real issue isn't what men think it is. Research from major medical institutions shows us that 55% of men express dissatisfaction with their size, while remarkably, 85% of their partners report complete satisfaction. This tells us we're dealing with a psychological phenomenon, not a physical problem. Think of it like this. Your mind works like a security system that's become overly sensitive. As we age, normal changes in our bodies can trigger this mental alarm system, making us hyper-focused on perceived flaws that others simply don't see. This is actually a recognized condition called small penis anxiety, which is a form of body dysmorphic disorder. The wonderful news is that this is completely treatable through psychological support. International medical guidelines and multiple analyses from respected journals like BMJ confirm that for these concerns, psychological counseling is the first line, safest, and most effective intervention. It helps many people avoid seeking invasive alternatives entirely. In my practice, when patients use this approach with their doctor's knowledge, they often tell me they feel freed from years of unnecessary worry. I'd love to hear about your experience with confidence and body image concerns. Have you found approaches that work well alongside your medical care? Share your story in the comments. Now, let's examine what doesn't work, the so-called miracle methods flooding the internet. As a urologist, I have a responsibility to share the medical reality about these approaches because the risks far outweigh any potential benefits. The Sexual Medicine Society of North America states clearly, penile lengthening and widening procedures are not recommended except in cases of medically diagnosed micropenis. Most methods remain experimental at best. For non-surgical approaches, the research is sobering. Penile extenders may produce modest gains of about 2 centimeters, but require hours of daily use for months and come with side effects like numbness and bruising. Vacuum devices have been thoroughly studied and show no effect on length. Their role is strictly for erectile dysfunction treatment. Injectable fillers are absolutely not recommended. I cannot stress this enough. The complications, including permanent deformity and tissue damage, can appear years later. The risks exceed any potential benefits by an enormous margin. Surgical options fare no better. Ligament release surgery doesn't actually increase the penis length. It only makes it appear longer when flaccid. Risks include loss of stability during erection, scarring, and angle changes. Many surgical procedures have never been properly studied in reputable clinical trials. Patient satisfaction rates are low while complication rates remain high. Any procedure should only be considered within a strictly supervised clinical trial framework. Don't become a test subject for unproven promises. What questions would you ask your doctor about these various methods? Comment below your questions. Help me create better content for our community. So what's the safe, effective path forward? The answer lies in building confidence from the ground up and supporting your overall health, an approach that works with your body's natural wisdom. Your circulatory system works like a well-maintained plumbing network. As we age, normal changes occur in our blood vessels, which is completely natural. Supporting this system through evidence-based nutrition can help you feel more energetic and confident because better circulation supports overall vitality. Research from respected medical institutions supports this approach. Studies with people over 60 show that certain foods can help support cardiovascular health. In my practice, when patients incorporate these with their doctor's knowledge, they often tell me they feel more vigorous and self-assured. Here's exactly how to support your circulation naturally. What you need: fresh pomegranate juice and ginger, both available at any grocery store. When to do it: include 23 ounces of pomegranate juice daily and fresh ginger in cooking or as tea. How to do it: start gradually. Add pomegranate juice to your morning routine. Use fresh ginger in meals or steep as tea. What to expect: most people notice improved energy within 24 weeks. Some feel changes sooner, others take longer. Both are perfectly normal. Studies show pomegranate can help support healthy blood pressure and arterial health. Research indicates ginger provides antioxidant properties that encourage healthy circulation. The wonderful thing is, this works with your body's own systems, not against them. With your doctor, I always encourage patients to mention these additions to their healthcare team, especially if you're taking blood pressure medications or blood thinners, as these foods may interact. Most doctors appreciate when you take active interest in your cardiovascular health. But remember, the foundation remains psychological wellness. When Robert began working with a counselor alongside our nutritional approach, that's when he experienced the most dramatic improvement in confidence. The combination of addressing his mental concerns while supporting his physical health through circulation-friendly foods created lasting positive change. This comprehensive approach addresses what research shows is the real issue, the psychological component that's causing distress. Rather than chasing risky procedures that promise physical changes, we focus on what actually works, building genuine confidence and supporting the health you already have. Working with your medical team gives you the best results because everyone's health picture is unique. Your doctor knows your specific situation best, including any medications that might interact with nutritional changes. This partnership approach ensures you're getting safe, effective support. The evidence is encouraging, and the real-world results speak for themselves. When we stop fighting against our bodies and instead support our natural health and psychological well-being, men consistently report feeling more confident, energetic, and satisfied with themselves. This isn't about accepting limitations, it's about recognizing that true confidence comes from comprehensive wellness, not from risky procedures that promise quick fixes. By supporting both your mental health and your circulation, you're investing in improvements that enhance your entire quality of life. If this evidence-based approach resonates with you, please subscribe for more practical wellness education that honors your relationship with your healthcare provider. Share this with someone who values both natural wellness and medical expertise, because every man deserves to feel confident and healthy at every stage of life.